Now, a question about a 53-year-old woman comes to the office for removal of multiple nevi. On injection of lidocaine, which of the following signs and symptoms uh, likely suggest lidocaine toxicity in this patient? Is it bronchospasm, hypertension, tachycardia, tinnitus, urticaria? The answer is D. Tinnitus. Signs and symptoms of lidocaine toxicity include dizziness, agitation, lethargy, tinnitus, metallic taste, perioral paresthesia, slurred speech, euphoria, hypotension, and bradycardia. Tachycardia is not a sign of lidocaine toxicity. Bradycardia is more common. Bronchospasm and urticaria are not signs of lidocaine toxicity. According to other case, the first one was 53, the other one is 35-year-old woman undergoes suction-assisted lipectomy of the bilateral arms using a tumescent technique. A total of 500 ml of aspirate is recovered. She is discharged home the same day and returns to the emergency department 8 hours after discharge. Lidocaine toxicity is suspected. Which of the following symptoms is most likely in this patient? Aniscoria, Coria, petechial rash on the neck and axilla, supraventricular tachycardia, tachypnea, tinnitus. The correct answer is E. Also, safe doses of lidocaine in tumescent solution can reach 35 kg, 35 milligram per kg. Lidocaine toxicity is still a risk. Peak plasma levels of lidocaine when injected into fatty acids occur 10 to 14 hours after infiltration. Lidocaine toxicity symptoms include neurologic or cardiac toxicity. In the early stages, the complications are primarily neurologic and can include slurred speech, restlessness, tinnitus, and a metallic taste, as well as numbness of the mouth. As the concentration increases, the neurologic concentration becomes more severe and can progress to muscle twitching, seizures, and cardiac arrest. Treatment of lidocaine. Treatment of lidocaine toxicity is supportive. A petechial rash of the neck and axilla is a typical sign of fat embolism, and tachypnea is a typical sign of pulmonary embolism. Anisocoria can be a benign finding, although it is a new finding. It is suggestive of Horner syndrome or a brain aneurysm. Supraventricular tachycardia, SVT, refers to tachycardia that occurs above or at the atrioventricular node. Paroxysmal atrial fibrillation and Wolff Parkinson White syndrome are the most common forms of SVT. SVT can cause syncope and long-term cardiac damage. Another question is about an otherwise healthy 48-year-old woman undergoes excisional biopsy of a skin lesion on the chest under local anesthesia with 30 ml of 1% lidocaine with 1 on 100,000 epinephrine. Weight is 1,000 76 libra, nearly 80 kg. The patient says she has light headache, and palpitations 5 minutes into the case after administration of anesthesia. Cyanosis and tachycardia are noted. Oxygen saturation is 90% and supplemental oxygen is administered. Methemoglobinemia is suspected. Administration of which of the following antidotes is the most appropriate next step? Uh, we should use dantrolene or glucagon, insulin or methylene blue or propranolol. The choice is D, methylene blue. The correct response is option D, methylene blue. The most appropriate next step in management in the administration of methylene blue as an antidote for methemoglobinemia. Methemoglobinemia is a clinical condition in which hemoglobin is unstable to carry oxygen to end organs due to the formation of methemoglobin. Red, hemoglobin is unable to carry oxygen to end organs due to the formation of methemoglobin. Red blood cells contain 4 hemoglobin chains. Each hemoglobin molecule is composed of 4 polypeptide chains associated with 4 hem groups. The hem group contains an iron molecule, uh, oxygen to form oxyhemoglobin. Hemoglobin can accept and transport oxygen only when the iron atom is in its ferrous form. When hemoglobin loses an electron and becomes oxidized, it is needed to form a bond with oxygen and thus is uh, incapable of oxygen transport. Local anesthetic can act as oxidizing agents for the ferrous from form of iron. Oxygenated blood is red, oxygenated blood is blue, and the blood containing methemoglobin is dark reddish brown color. This dark hue impairs clinical cyanosis when methemoglobin levels are at 1.5 gram per deciliter, approximately 10 to 15%. Similar effects.